Hi everyone, welcome to Icmfel, our medical reality talk show. This is our 16th edition. We want to welcome you that are joining us today, and we're excited to be back since last month, and we're glad to be here today. I have with me as my co-host and a very special guest, both joining me here from China. And it's exciting that we're going to be here together. And like I said, this is the 16th edition of our medical reality talk show. And today we're going to be discussing a very special topic on colorectal cancer and colonoscopy. And so, with me as co-host is Dr. Faustin, and joining me right here. Welcome, Dr. Faustin.
Thank you so much, Dr. Vala. How are you doing?
I'm great. I'm great. So, how is your part of Guangzhou there? Is the weather and
Yeah,
everything?
it's good. It's raining and all, but we're good. We are good.
Yeah. So great. We're going to be having Dr. Jira Abesa with us today, and it's going to be we're looking forward to have a very interesting discussion. And so I want to welcome Dr. Jira. Dr. Jira joining me there, and also from Guangzhou. Dr. Jira, you're welcome.
Thank you, Dr. Bala. Uh, how are you doing?
I'm great. I'm great. Thank you for accepting our invitation, and thank you for joining us today to discuss the very
I'm Anna.
important topic.
Thank you for having me. It's my pleasure to join you guys today.
Okay.
And thank you, Faustin, too, for uh, co-hosting this thing and giving us the opportunity to come and discuss about some serious topic, medical serious topic here today. Thank you, guys.
All right. So we have audience from all around the world. We are live on Facebook, YouTube, Twitter, and so we want to say welcome to all of our regular followers and medical students and colleagues from all around the world. And that usually join us so we can be able to look at some of the reality things that we deal with in the hospital. And we believe that sometimes we don't have these opportunities frequently. So to have the experts with us here is a great opportunity. So thank you again, Dr. Abessa. So let's go straight to the discussion. We are discussing today colorectal cancer. And as an expert in this field, we want to first of all start by the definition. So, Dr. Jira, what is colorectal cancer?
Okay, thank you, Dr. Bala, for this opportunity. And indeed, it's a really important topic that we should be talking about. And unfortunately, so many people are not aware of the danger and of the possibility of treatment for the colorectal cancer. So I will start by giving a really brief and simple definition of colorectal cancer. Uh, so as you can hear for the name colorectal, colo stands for colon, and then rectal for the rectum. So if basically the
So,
cancer
for Dr. Jira,
can you hear me?
yeah, let me interrupt you there. For the layman, what is colon? Maybe what's the simple term? Which part of the body is
Yeah.
that colon?
So I was coming to that. The colon basically is just the large intestine. You know, we have the small one and then the larger one. So the larger one is where the one that drain out basically our faces. So yeah, and then the rectum is now the canal that join our anus to the large intestine, which is the colon. So any cancer that affects that line is called colorectal cancer, or just colon cancer in general.
Okay, so basically we're talking about our large intestine here. It's possible that our large intestine can have cancer. And so for the
Mhm.
layman that is following, we're talking about, many times when we talk about cancer, people kind of get confused, right? They don't really know, when they say cancer, maybe kind of they've said that. Of course, cancer is not something simple to look at, but cancer can be in the intestine, it can be in the brain, it can be on the liver, just many places. So today we're talking about cancer on the large intestine. So, simple way, Dr. Gerard is saying that Dr. Gerard is saying that any cancer on the large intestine is colorectal cancer. Is that what I'm getting right?
That's right, Dr. Bala.
So, what are some of the causes and the symptoms of colorectal cancer?
Okay, so talking about causes, unfortunately, we are not aware, we are not fully aware of what causes colorectal cancer. So many studies are still like going on to find out the exact causes of this thing. And just like many other cancers, the causes are not known to us yet. But then there are some stuff that there are some risk factor that can predispose someone to have those to have the colorectal cancer. So, and I want to emphasize on the fact that there are different types of colorectal cancer too, and they have the adenocarcinomas. Those are really technical terms, but the one you're going to focus on right now is the adenocarcinomas, which develop from a polyp. So the symptoms, okay, talking about the causes, we say the causes are unknown, but then we know that we can, if someone has really bad diet, a diet that is really high on meat, high fat diet, low fiber, or someone is taking heavy alcohol and all those can predispose someone to have colorectal cancer. And then talking about the symptoms, you can have colorectal cancer without having any symptoms at all until the late stage. So that's a bit scary. But then there are some unusual, non-specific symptoms, such as maybe having blood in your stool, maybe being constipated usually, or having diarrhea, unexplained weight loss, unexplained abdominal pain, just being too much tired, exhausted all the time, and unexplained anemia. So we can see that those symptoms are not specific to just colorectal cancer. That's where the problem comes. That's why we need to find it earlier to be able to diagnose it and treat it. Yeah.
Wow, that's very scary. Talking about having the cancer with no symptoms until late stage, and that means like the moment you are already
And
like
then,
yes, close to the grave, right? That's really really scary. And you're talking about diet. So talking about the risk factor, who are those that are at risk? I've heard people talk about like the ordinary people would tell you, don't eat certain kind of preserved food, like the chicken from the cold storage, those different preserved food people warn you. I hear a lot of people warning about, it's gonna give you cancer. When you eat food that are preserved in a cup, or if you eat food that are preserved from the cold storage, like those chicken, those different preserved meat. You're talking about diet and then talking about risk factor. Do you want to say something about that?
okay, so first talking about diet, diet is really important. Almost every diseases that we have, that we develop, is somehow linked to what we eat and how we eat. So uh, even colorectal cancer goes by the same rule. If you have really low vegetables, low diet, fruits and vegetable diet, really low fiber diet, and then really high fat diet, that can predispose you, of course, to being overweight. And then just like you have mentioned, if you eat too much of processed food, because in the processed food, there are so many additives, and some of them are like cancer, pre-cancerous. That's mean they can easily cause cancer. So getting involved or getting uh, eating those things too often can predispose someone to get colorectal cancer. But there are some other risk factors like age. If you're over 40 or 45, you have higher risk to have colorectal cancer compared to one teenager. So by the older you get, the higher risk to get colorectal cancer. And then you have some other stuff like family history. If you have a parent that already have colorectal cancer, you have higher risk of having colorectal cancer too. If you have if you had one colorectal cancer before that you have been care of, you still at a higher risk to develop again colorectal cancer. And then you have lifestyle. People who don't exercise a lot, they have high risk of having colorectal cancer. As I've said before, people who drink too much, alcohol abuse or tobacco abuse, all those can predispose you somehow to colorectal cancer. So yeah, so it's all over everywhere.
All right, thank you so much, Dr. Gerard, for that. I got another question to add up. You say that people sometimes find out about a disease, but it's kind of late. So my question is, what could be the treatment based on the staging? Like some people can have you say they can find it very late in the stage, some people can find it early. So how are the treatment differentiated?
Okay, thank you, Dr. Mbulu, first thing for that. To talk about treatment, first you have to know, that's why you said the staging is really important, because when you are diagnosed at a really, really early stage of the disease, you have higher chance of receiving good treatment and effective treatment. So basically, we can divide the whole staging things into 5 stages. So the first stage is like the stage 0, where the cancer has not completely been formed. We call it like carcinoma in situ. So it's when you just find, it's just like at the beginning, at a very, very early stage, where the cell, because we know that cancer itself is like abnormal growth of a cell. So when the cell or the inner line of the colon starts to grow, but hasn't completely, it starts to change, but hasn't completely changed into cancer, that stage is called stage 0. And that stage 0 is really most of the time when we see the polyps. I will talk about the polyps later when we talk about colonoscopy, but then those polyps can be easily removed during the colonoscopy. So they'll be completely cured and cancer free at that stage. So when you move again further, you come a bit late, and then your cancer has improved and you reach the stage 1. So the stage 1, we know that the layers, our colon has different layers. So we have the mucosa, we have the submucosa. So the deeper the cancer gets, the late you are in the staging. So and then the once you get it, or the low is your chance of getting cured from the disease. So in this stage 1, the cancer has formed now completely. It's cancer. It's not like the difference between the stage 1 and stage 2 is like now the cancer has completely formed, and then it has involved now the mucosa and the submucosa. So it's going like the first 2 layers of the intestine have been involved already, but then it hasn't gone past the whole layer of the colon. So in that situation, you can have like you can be treated on under colonoscopy too. We have some surgery that we call ESD. I can completely resect that, or you can just go for a surgery, and they will cut off that portion of the colon that has the cancer, and then connect by the healthy 2 ends together. Yeah. And then when you move to the stage 2, now the cancer has gone deeper. It has almost covered the whole layer of the colon. But then we know that around our colon we have some lymph nodes and all. So the cancer has not affected the lymph node yet. So it gets worse, but then the whole layers of the colon has been affected, but the surrounding lymph nodes are not affected yet. Why is it so important? Because once your lymph nodes are affected, so the disease is gonna spread really quickly in your body. So at that stage 2, you still have some chances of getting surgery, but then now we recommend extra chemotherapy. Have some chemotherapy. And for those who cannot get the surgery, then we can recommend some radiotherapy to go along with the chemo for them. So when you advance to stage 3, now things are getting serious. The lymph nodes are affected, and then maybe sometimes some of the surrounding organs are affected too. So now your chances of receiving a good outcome from the surgery are really, really low. The most important thing for you now will be the chemotherapy and the radiotherapy. Even though in some situations we can still get a surgery, but then now the chemo and the radiation takes more important place in the treatment. And then the last stage, which is so many people can come at this last stage, which is the stage 4, where the colon has spread all over to the lymph node. It went inside your blood. It has reached so many other organs such as your lungs, your brain, sometimes your liver, and all. So it has spread all over your body. So at this stage, surgery won't be of great use for you. And the most important aspect of the treatment will be a chemotherapy. So our goal is to catch the cancer as early as possible at stage 0 or stage 1, so you can receive complete, you can secure from that, from the cancer. Yeah.
Thank you so much, Dr. Abassa, for that. But here in a nutshell, what you said, if I understood properly, the earliest is the better. Because if you find it when it's in the early, like you say, stage 0, it's easy for you, a doctor, to treat it compared to when somebody comes in stage 4. Is that
That's
so?
right.
All right.
Right.
Okay. I have a question based on what you said. So now, how do we know the indication of screening? Like, at my age, can I go for screening? What is the actual age, and what are the indications for starting to screen?
Okay. So screening first, before talking about the indication of screening, I should talk about what is screening though. Screening is when we try to find a disease even before you start having the symptoms.
Hmm?
So maybe someone can be walking on the street feeling good, but they have already a colorectal cancer inside them, and then they are carrying that. So you want to catch that person, you want to diagnose that person as early as possible. So some screening tests. So basically, it differs from countries. In the United States, they recommend 45. So everyone in the general population that is 45-year-old or above has to visit their GI doctor to have a colonoscopy done. So that's the general rule. But
I
then
just
if sorry,
as you to do it at 45 at 8 months, does it mean they do it only once and that's it, or do they have to do it in a certain time amount of year?
yeah, so the general population, if you reach 45, you have to get your first colonoscopy done. That is when if you didn't have any other colon issues before 45. So you have your first colonoscopy done at 45. If it's clear, if everything is clear, you don't have any polyps, everything is normal, then the next appointment for you should be maybe after 10 years. And then all those depend to all the preparation of your body, because we will talk about that during the colonoscopy thing. So, but then if you have a family history, for example, if your father or your mother has colon cancer, maybe at the age of 45 when we got screened, then you should start like 5 to 10 years earlier than them. So you, the second generation, you have to start. You have to have your colonoscopy done at the age of 35. So
All
that's
right.
like the general rule, especially in the US. But here in China, because the colonoscopy is very easy to book and it's quite relatively cheap, so we recommend to people to get it done even earlier than that. Maybe by your 30s that you have to get the colonoscopy done. I've had 2 colonoscopy done already, you know. So
Wow.
yeah, in other countries too.
Okay. So just as you are an expert, what would be your answer to somebody? Shall I do it at 30 or shall I wait for 45? What is your definitive answer as an expert?
Okay, just like I'm saying, if you're having symptoms, like if you're having unexplained constipation, that's like those risk factors that I've mentioned before. As
Yeah.
long as you start having those red flags like blood in your stool, uh, uh, constipation or unexplained weight loss, unexplained anemia, you should just get the colonoscopy done right away, regardless of your age. Even if you're 20 or 19, we have diagnosed so many young people at the age of 25 with really huge tumor in their colon. So once you start having the symptom, the red flag, just go for the colonoscopy. If you don't have any symptoms at all, then I will stick with the 45. You can wait until 45. But
Thank you
then
so
if you
much.
have any symptom, just go for it.
Thank you so much. Okay. Question. I would invite Dr. Bala.
So talking about colonoscopy, right? That's very interesting. Kind of sound a little scary. You want to like, especially when you mention the issue of constipation and all of those different symptoms people have. I'm kind of getting scared. I think I need to do one already. So what is colonoscopy? People want to know. People, and I've heard you say that over and over, especially when you're talking about the screening. So what is that? How is it performed? and what are the different bowel preparation for that? Is it painful? Is there any risk associated with that? So maybe I'm already 40 and thinking about doing that. You want to say a little bit about what is colonoscopy?
Yeah, everyone panic when they hear about colonoscopy, especially when they hear how it is done, how it's performed. But before going to that, I really want to emphasize on the fact that colonoscopy is not the only way of screening for colorectal cancer. We have other means like the you can check some trace of cancer in your faces, in your stool. So even though colonoscopy is the most important screening tool that we have now, but then people can get the we call it like a fecal blood record, where you check for presence of blood in your stool, the trace of blood in your stool. So that is one screening tool that we also do beside the colonoscopy. So coming to colonoscopy itself, the scary thing, basically the colonoscopy is just using a scope, which is a tube that has a camera at the end with some lights at the end. You pass that through your anus. So you go all over through your colon looking for any abnormality, looking for a cancer, looking for the polyp, you're looking for any inflammation. Whatever we can find that is abnormal, we want to look at it and then you want to be able to treat it. There's so many treatment that you can then you can get done under colonoscopy. So that's basically the easiest way of presenting it. So is it painful? So we have basically two types of condition in which you will stay during the colonoscopy. You can be sedated, where you can be like fully sedated, completely knocked out under anesthesia, where you don't feel anything. So that's the most convenient one for both the patient and the doctor. But then there is the one that you're not sedated, so you are completely fully aware of what is happening. So is it painful? It depends first on the skill of the doctor who is performing it, and then depends on the shape of or the size of the patient. So for example, someone who is really tall and skinny will feel more uncomfortable during the colonoscopy than someone who is fit. And then someone who has like a really big belly will feel more uncomfortable than someone who's relatively fit. So your size, your shape too can affect how you feel during a colonoscopy. And then, like just I've said, the skill of the doctor who is performing it, of course, is really important. But the major issue for people right now is the preparation, because you cannot just come there. You know that our colon, our large intestine is the pipe that carry out the stool out of the body. So obviously it's full of stool all the time. So you cannot just come there like that and get a colonoscopy done. You have to have you have to prepare, you have to cleanse your bowel. So that process can be uncomfortable for some people because you have to drink a lot of water with some medicine, and then you have to go through some specific diet before, like 2 to 3 days before the procedure. You have to eat less meat, no colorful juice, no colorful food. You want your body to be as clean and uncomfortable as possible. So the preparation can be uncomfortable sometimes. You have to drink from 2 liters to 4 liters of the laxative that we give people. So that can be sometimes difficult for people to take.
Okay.
So yeah, and then we're talking about the risk. If there is any risk in the colonoscopy basically is a really, really safe procedure. When it's mastered and done by a professional, it's really safe, and then it can be really fast if there is nothing abnormal inside there. So, but of course, every procedure carries a risk. So the most important risk that we want to avoid is perforation. And then perforation can be related to maybe the condition of the bowel. That's why the bowel preparation is very important. And then the skill again of the doctor who is performing the colonoscopy. So perforation is the major risk, and then you can have some bleeding, which is really rare. But then yeah, the risk exists of bleeding after a colonoscopy. And then some people might feel bloated because during the colonoscopy you have to inflate your colon, because normally it's closed up, so you have to inflate it to enlarge it so that you can see inside it clearly. So people can feel maybe some uh, abdominal distension, bloated after a colonoscopy. So all those are minor issues. You just have to wait for a while, pass some gas, and then you'll be fine.
Okay. So as we wrap up, we see that we are running out of time. So let me just ask, what about people in the places like in certain African countries where instrument hospital not ready equipped to do colonoscopy and all of that, even at the age of 45. What would be your patent statement? What would be your advice to people in that kind of environment, or doctors who find themselves in that kind of environment? Probably you see symptoms, but you don't have the luxury maybe to do colonoscopy, even for the 5 years old patient who you seeing symptoms, or I'm in the an African country somewhere in an environment where I don't have the luxury of those equipment around hospital. What would be your advice in terms of awareness, in terms of prevention, in terms of earlier you know treatment choices? What would be your advice and as your parting statement to we close? Because then we have
All right.
audience.
So for that question, I will answer in two parts. The first part is where you don't have the equipment necessary to perform a colonoscopy, like in some remote places where you don't have. But I have to mention that now, even Africa is doing a really good job. Like I can say that is you can easily get a colonoscopy done almost in all part of Africa nowadays. But then still there are some remote places who don't have, or maybe they don't have a skillful doctor to practice to perform a colonoscopy. So in that situation, you can have thought about checking for the presence of blood in the stool, because we know that cancer can easily bleed. Cancer, they grow really fast. The cancer cell grows really fast, and then it can bleed. So when you bleed, when the cancer start bleeding, you can see some traces of the blood in your stool. So the doctor who does not have a colonoscope at his place can just check for the presence of blood in the stool. That's why you call FOBT, the fecal blood, occult blood test. But then that does not guarantee or does not mean that you have cancer automatically, because you can have some hemorrhoid that is bleeding. You can have some maybe Crohn's disease or any other inflammation of your colon that can cause the bleeding. So once you have a positive blood, they have found blood in your stool, then that person should find a way to go for a colonoscopy. Okay, but in the scenario where the colonoscopy is there, you have a skillful doctor who can perform that, but the patient is not uh, has so many contraindications to have that done. So we can do same. You can check the blood in the stool. You can check. You can do some barium swallow, which is like we give some barium solution to the patient to drink, and then when the barium passes through the colon, we take some radiographic pictures, so that through that specialists will determine whether you have a tumor in your colon or not. And then we can also do a CT if there's possibility. If you have some too many contraindications to undergo a colonoscopy, you can just have a CT. The CT will show if there is a mass there, an obstruction there. But the gold standard to make a diagnosis, of course, is for us to go inside there to take a biopsy, to take some tissue or some cells, and then confirm the presence of colonoscopy. So yeah, colonoscopy is the gold standard, really important. And then I hope that all the facilities and clinics all over the world will be equipped with one. Yeah.
Okay, because of time, we're gonna be wrapping up here. So, our audience, wherever you're watching from, if you have questions, you can just send your question, and I would ask Dr. My co-host, Dr. Faustin, if you have any parting statement to see if there is any question coming in, and Dr. Faustin can give a parting statement, a parting comment, then before we do our announcement. Dr. Faustin, any parting statement?
Thank you so much, Dr. Abassa, for this insightful presentation and for your patience with us. giving us this much knowledge, because a lot of people out there don't really know about that unless they went into a medical school. And I believe this is really insightful, not only for the medical student and the doctors following us, but also for the general population to know about time, the age where they have to start the screening, and especially if they have risk and all the stuff. So we thank you so much for that insight.
So thank you so much, Dr. Isaac. Thank you for coming to talk to us today. And thank you, my co-host, Dr. Faustin. And it's been a great time. Now we're going to take a couple of announcements, and then we're going to be saying goodbye to you. And we're going to be hosting our international medical conference come the 25th. So we're just going to be giving that announcement. We want to encourage you to sign up. If you are a medical student, a nursing student, a professional health worker, or an other health worker, anywhere in any part of the world, we want you to sign up for the international medical conference coming up very soon, and we will be glad that you can sign up. The workshop is going to be interesting. When you sign up, there are going to be certificates to those who are going to sign up for the workshop. So I'm going to play that. But before I do that announcement, I'm going to ask Dr. Gerard to give a parting statement, then we do the announcement.
All right, thank you. It has been a really interesting discussion. Just one quick takeaway message for everyone. Colorectal cancer is, of course, it's scary when you hear cancer. But you have to know that it's something that can be cured, can be treated well. So whenever you go for a colonoscopy to get screened, when you have it, don't fear. There is a treatment for that. It's one of the few cancers that you can say with proudly that we can treat, we can cure. So come as early as possible and get your treatment. And before that, when you hit your 40s, go look for your gastroenterologist, get your colonoscopy done as soon as possible.
Thank you, Dr. Gerard. We are glad that we have the opportunity while we are here to be able to provide education to the public out there and also be able to share our expertise. It's been an honor, and thank you for having this very busy doctor giving us more than 35% of the time. This is worth millions of dollars, I can tell you that. So we want to thank you so much, Dr. Gerard, for joining us today. So that's the guy announcement, and we'll be here. I'm from the International Christian Medical Fellowship, and I'm here to invite you to our first International Christian Medical Conference. So this month, on the 25th of June, we're going to be having a medical conference and also our official launching. So we want to invite you to join us if you are a Christian and a medical professional, whether a student nurse, a student doctor, an allied health professional. We want to invite you to join us.
You heard that right. It's on the 25th of June of this year. So if you're a medical student, if you're a doctor, if you're in public health, global health, or you just want to learn more about medical stuff and knowledge, then you should tune into this conference.
International Christian Medical Fellowship, Icmfel for short, is having its first international conference and official launching. Hooray! With the theme, making contribution to global health, role of Christian medical professionals.
Log onto this conference and don't miss it. Well, the conference is free, that is the great news, and it will be held only for one day, so don't miss this chance. Don't miss your chance.
Especially on issues of global concern. Since we want to know how can we make contributions to global health, we will be having our first section. Will be a plenary section where we're going to have these great presenters talking to us about major issue of global concern. Then after that, we're going to have another section that will follow the presentation. That's going to be a workshop section, and it's going to be 3 different workshops running simultaneously, and we're going to have 3 great facilitators that are going to lead us through this time. So we're going to have a workshop section on opportunities in internal medicine, opportunities in surgery, and of course the importance of social media for the 21st century health services. So you can sign up for any of those workshops. And lastly, we have our launching ceremony, and we're going to have special guests. We're going to have March who is the president of KPNF in Canada, is doing good work in West Africa, speaking to us, and also Pastor Jordan, also from Canada, will be launching our fellowship. So we want to welcome you. Please sign up, and you can check in the chat there. The link is there. Just register. The launching and the presentation are going to be live. That's free and open to the public. That the workshop require registration and seats are limited.
I will be attending, so make sure you attend this conference.
Invite your friends, invite your friends' friends, and I hope to see you there. See you on the 25th of June of this year.
The time is 10 a.m. to 1 p.m. GMT.